In this video, I'm going to go over the mechanism of action as well as the clinical application of aspirin, non-steroidal anti-inflammatory drugs such as ibuprofen and naproxen, Celecoxib, as well as the acetaminophen. Now, in order to understand the mechanism of action of these drugs, we will have to go through the pathway through which prostaglandins are being produced. So, lipid membrane via the phospholipase A2 enzyme is being converted into arachidonic acid, which via the 5-lipoxygenase enzymes is being converted into leukotrienes. And leukotrienes function in bronchoconstrictions, and they also have local effects such as vasodilation in the skin versus vasoconstriction in the kidneys and hearts. And thus medications that inhibit the 5-lipoxygenase enzymes, or medications like montelukast or zafirlukast, which inhibits the leukotriene receptors, are used for the treatment of asthma. And then the other pathway through which the arachidonic acid via the cyclooxygenase enzyme is being converted into prostaglandins and thromboxane are particularly good for the treatment of inflammation as well as fever and pain, which is produced by the prostaglandin E2, and then they also prevent the platelet aggregation, which is induced by the thromboxane A2. So therefore, these classes of medications can be used for their anti-inflammatory properties, antipyretic, analgesic, as well as the antiplatelet properties. So now let's go back through this list here and then discuss the function of every drug. So aspirin irreversibly inhibits the cyclooxygenase enzymes versus NSAIDs such as ibuprofen, which reversibly inhibits these drugs. Now back to aspirin, this medication is irreversibly inhibiting, and thus depending on the dose that you're applying, it can be used for its anti-inflammatory, antipyretic, analgesic, as well as its antiplatelet properties. So if you use the dose of less than 300 milligram, then it's good for its antiplatelet properties, and thus it increases bleeding time, but then PT and PTT remains normal in these patients. And it's actually shown that the aspirin supplementation decreases the risk of myocardial infarction by 20%, and it increases the lifespan of the post-myocardial infarction patient. So it's recommended for patients that are over the age of 50 and do not have any risk of significant bleeding to start taking the low-dose aspirin supplements like the 81 milligram tablets. Then the higher doses like 300 to 2400 milligram is good for its antipyretic properties, while above 2400 is used for its anti-inflammatory properties. And then all of these medications are also controlling pain by decreasing the levels of prostaglandin E2. You should also be aware of the side effects of aspirin, which include, for instance, tinnitus or ringing of the ears. It can cause interstitial nephritis in the kidneys, and it can also cause the gastric ulcers, because prostaglandins are the enzymes that will protect the lining of the GI tract, and the aspirin is inhibiting the secretion of prostaglandin and thus increases the risk of gastric ulcers. And thus in these patients, you can provide them with the enteric-coated aspirin to help prevent the gastric ulcers. In addition, aspirin supplementation in children can cause Reyes syndrome. So you should avoid aspirin in children because it can cause Reyes syndrome, which is a hepatoencephalopathy that can develop in these patients that can cause edema in the brain, as well as due to the damage to the mitochondria in the liver. These patients also present with the hepatic symptoms. So if you have a child that had a viral infection and then the parents tried to control the fever by giving the patient aspirin, and then later on the patient developed coma as well as seizures, then you have to suspect a Reyes syndrome in these children. And then you should also know that the only case where you can use aspirin in children is in patients that have Kawasaki syndrome. The next group of medications are NSAIDs like ibuprofen, which reversibly inhibit the COX enzymes, and thus because they are only reversible and the effects are temporary, they cannot be used for their antiplatelet properties, but they still have the same anti-inflammatory, antipyretic, as well as analgesic properties. And the side effects of NSAIDs include interstitial nephritis. They could also cause renal ischemia due to the vasoconstriction of the afferent arterioles of the kidneys, and then similar to the aspirin, they can also cause gastric ulcers. So given that the NSAIDs and aspirin are both causing gastric ulcers, then we have this other medication called Celecoxib, which selectively inhibit the COX-2, and thus by not inhibiting the COX-1, this medication is not associated with gastric ulcers. So let me differentiate between the physiological function of COX-1 and COX-2. So COX-1 is the enzyme that produces prostaglandin that maintains the GI lining as well as renal perfusion and help in blood clot formation. Versus COX-2, which is a prostaglandin that is involved in inflammation and pain perception. So therefore, Celecoxib, by only specifically inhibiting the COX-2, it works by inhibiting the pain and inflammation, and thus it does not cause any gastric ulcers or the other renal ischemia symptoms that were described with the NSAIDs or aspirin earlier. And then regarding the adverse effect of Celecoxib, you should know that it's a sulfa drug, so you must avoid it in patients with sulfa allergy, and then you should also know that Celecoxib increases the risk of thrombosis. And then the final medication is acetaminophen, which inhibits the cyclooxygenase enzyme in the central nervous system, and thus it's good for the decreased perception of pain, as well as for its antipyretic properties. But this medication cannot be used for anti-inflammatory or anticoagulation properties. So if there is a patient that has fever or has pain, then you can treat them with acetaminophen. You should also know that the main side effect of acetaminophen is liver toxicity due to the depletion of the glutathione pool, which acts as an antioxidant. And thus for the treatment of overdose in these patients, you will have to provide them with the N-acetylcysteine, which provides cysteine for the synthesis of the glutathione, and then it also directly interacts with some of the toxic metabolites of the acetaminophen. And that concludes our discussion.